Thank you, Dr. Wiebe, and thank you for the opportunity to be here today. Yes, I was asked to provide sort of a perspective of how these illnesses affect our youngest patients and children, as well as a public health update on a few things. I will talk about similar illnesses you've heard of, and I also wanted to provide an update on the situation around pertussis in our community. So starting with RSV, this is a very common virus in the pediatric population. Most studies show that around 80% of children have been infected with RSV by their first birthday, and nearly everyone by their second birthday. So this is out there. It causes a high burden of disease in our most vulnerable children. It is, in fact, the most common cause of hospitalization for infants in the United States under the age of 1. And while prematurity or being born early and maybe having an underlying chronic medical condition can increase that risk of coming into the hospital, almost 80% of children that are brought into the hospital for RSV are actually healthy term babies who have no underlying health issues. And every year in the United States for kids under the age of 5, we experience anywhere from 100 to 300 deaths due to RSV. But as was brought up, we do have 2 forms of protection this season, both highly safe and effective. So the first form is for pregnant women to receive a maternal vaccine toward the end of their pregnancy if it's in the right season, and that provides protection for our youngest infants against this virus. And we also now have RSV immunization available for all infants under the age of 8 months and some older infants who remain at higher risk if they're entering or during their first season of RSV. So these products worked, particularly the infant immunization worked extremely well last season, reducing the risk of severe disease by upwards of 96%. For flu, in typical flu seasons, we know the pediatric disease burden is high for influenza. Children consistently have very high, if not the highest, attack rates in communities, and there can be numerous complications of influenza for young children. Our hospitalization rates are the highest for children in the age group of less than 5 years. And just a robust body of evidence is out there for the safety and effectiveness of the flu vaccine in preventing hospitalization for children. So as was stated, we encourage everyone 6 months and older to get an annual flu vaccine. For COVID-19, unfortunately, COVID-19 is still out there infecting kids, causing disruptions in school and activities and the like. While some children will experience mild disease or even no symptoms at all, we do know other children become very ill from this virus and need to come into the hospital. And interestingly, the majority of children who are hospitalized for COVID-19, again, have no underlying medical conditions. These are just healthy children. Our hospitalization rates for COVID are highest in the under 4 age group, but especially high risk is under 6 months. Which are babies too young to be vaccinated themselves. So this really highlights the importance of maternal vaccination to provide that protection, as well as anyone who might be around young babies as well. And unfortunately, children of all ages do die from COVID-19 statistically at a higher level each season than even influenza in the pediatric age group. So as was pointed out, again, we have protection for this. We have updated vaccines that are contain strains that currently target our circulating variants that we're seeing. So any child 6 months or older is eligible to receive a COVID vaccine this fall. Last season, the newly updated COVID vaccines for children provided an additional 40 to 60% protection against severe disease. And then I just wanted to end on talking about pertussis or whooping cough. North Dakota, in particular, Cass County is experiencing an ongoing pertussis outbreak. So Fargo Cass Public Health actually put out a news release about this earlier this week, as did the North Dakota HHS, just because of a concerning rise in cases that we've been seeing. So since January, the start of this year, North Dakota total in the state has experienced 56 cases of whooping cough. 42 of those have been in Cass County. That's higher than we are used to. As a point of reference, in a typical full entire year, in Cass County, we will see like 5 to 8 cases. And of note, since just very recently here, August 1st, North Dakota has had 21 new cases. 16 of those have been in Cass County, including an individual who has required hospitalization, is actually still in the hospital. In the spring, we were seeing this primarily targeting our adolescents, which is not that unexpected. They have maybe are due for boosters or having some wane immunity. We had a little bit of a lull in the summer, and now this current rise we're seeing is in our very young children, primarily in kids under the age of 5. I think we're seeing our child care centers and daycare centers be impacted, and now we're starting to get positive cases and exposures in our schools as well. So just really wanting to alert the public that we're seeing this. It's out there. People who've had whooping cough or even had a vaccine for this can be at risk for a repeat infection after about 5 to 10 years. So this is one that being up to date on your vaccination is really you and your family's best protection against pertussis. And so the 4 illnesses I've discussed here can all be protected against during pregnancy. We now have safe and effective maternal vaccines, so we really encourage any pregnant person in the community to speak to their provider about possibly receiving these. And then just in general, as we all head back into schools and child care centers this fall, it's more important, now more than ever to have all vaccines. Excuse me, but particularly the key ones that we've touched upon today for the respiratory season. We know being up to date on vaccination not only provides you and your family safety and well-being, but really minimizes disruptions in your daily life and within the community. Thank you very much.